going to be talking about dysthymia. I've been on YouTube, and when I search dysthymia, I don't really find too many videos, mostly because I think it's not a very well-known mental illness. So I thought I'd just talk about it, and this is my first video, so bear with me. My webcam isn't that great, but so dysthymia is literally, it means, in Greek, it means bad state of mind. It's been called many different names. There's neurotic depression, dysthymic disorder, chronic depression, but the DSM-5 replaced dysthymia with persistent depressive disorder. And this disorder includes both chronic major depression and dysthymia. And I'll try to stick to the term dysthymia just for the sake of this video. I might say like chronic depression, but it's the same thing. So dysthymia, it's a depressive mood disorder, and it's characterized by chronic, persistent, but mild depression. It affects 3 to 6% of people. And to be diagnosed with dysthymia, you have to have been in a depressed mood that persists for at least 2 years and that lasts for most of the day on more days than not, and accompanied by at least 2 of these symptoms. These symptoms are poor appetite, overeating, insomnia, or hypersomnia, which is sleeping too much, low energy or fatigue, low self-esteem, poor concentration, or difficulty making decisions and feelings of hopelessness. Many people have early onset dysthymia, which means that their symptoms began before the age of 21. For me personally, I do have the dysthymia. I've been diagnosed with it, and I've had it since I was around 10 years old. So I'm going to be just like slightly describing how these facts about dysthymia relate to me. But I'm going to keep it more focused on just informing you guys about what dysthymia actually is. So one of the misconceptions I've seen about dysthymia, most people don't even really know what dysthymia is. It just gets lumped together with depression, and people have usually have never heard the term dysthymia, but when they figure it out, since it's considered mild, many people think dysthymia is probably not as difficult to deal with as major depression, but that's not necessarily true. Major depression is considered to be episodic, while dysthymia is persistent and can last for several years and even life if it's untreated. It's considered to be less severe than major depression, but the consequences can be really bad. Some consequences are severe functional impairment, increased morbidity from physical disease, and even increased risk of suicide. People with chronic depression have more severe impairments in social, psychological, and emotional functioning, increased healthcare utilization, and more frequent suicide attempts and hospitalizations. I have attempted suicide before, and I've been hospitalized once when I was 17. Studies also say that although dysthymic disorder is generally thought of as a milder disorder than non-chronic major depressive disorder, it is often a more severe condition when considered from a longitudinal perspective, since dysthymia is longer lasting. Also, you don't have to have just one or another. You can actually have major depressive disorder and dysthymia at the same time. And they call this double depression. I know that sounds kind of weird, but that's what they call it. It's double depression. And a longitudinal study found that 76% of dysthymic children develop major depression. Also, 75% of people with dysthymia meet the criteria for at least one major depressive episode. That's the double depression that I mentioned earlier. People with dysthymia and double depression can experience significantly higher levels of depression and spend more time in depressive episodes and less time fully recovered than patients with non-chronic major depressive disorder. Um, Personally, in my experience, um, when I have a major depressive when I have a major depressive episode, uh, I don't go back to normal, I guess you would say, because normal for me is dysthymia. So I'm just always kind of in this chronic low mood that doesn't really go away. It's not really like an extreme depression all the time. Like I can still get up from bed. I still do the things I need to do. Um, but if I'm done with an episode of major depression, I just go back to dysthymia. It's just a chronic low mood. Um, Most people, especially those with early onset dysthymia, have a family history of mood disorders like depression and bipolar disorder. One or both parents may have suffered from major depression, and a family history of this illness makes it more likely for dysthymia to appear in the teenage years or early 20s. Um, so for me, I think it started around 10 years old, I believe, is when I started feeling like really chronically low mood. And it also is biologically in my family. There's quite a bit of mental illness in my family. Specifically, my mom has suffered from depression and PTSD throughout her whole life, and there are many people in my family who also have mood disorders. There are associations between childhood maltreatment and early onset, recurrent episodes, and suicidality. Studies have also found that a lot of chronically depressed people have experienced abuse during childhood. One study examined various forms of maltreatment and found that the duration of illness was uniquely predicted by maternal abuse, maternal indifference, and parental overcontrol. Many people who have dysthymia also suffer from anxiety disorders. Personally, I also have generalized anxiety disorder, and that's it's commonly comorbid with mood disorders. I think it can be harder to diagnose dysthymia because compared with people who have major depression, people with dysthymia have more subjective symptoms and less dramatic abnormalities of sleep, appetite, and energy levels. So for me, I struggle a lot with my energy level, but most days I just kind of force myself to get up and go, and I can usually do it. My sleep and appetite actually do change a lot though. Sometimes I'll have weeks where I sleep too much, sometimes I'll sleep too little, sometimes I eat too much, sometimes I'll eat too little. But most of the time my sleep and appetite are pretty normal, but they can change a lot. It's not very stable. Um, as far as treatment, the best treatment for dysthymia, because it's chronic, is said to be a combo of psychotherapy and medication. Um, but since it's chronic, treatment resistance is common. There are positive responses to SSRI medication, which stands for selective serotonin reuptake inhibitors, SNRIs, which are serotonin norepinephrine reuptake inhibitors, and TCAs, which are tricyclic antidepressants. SSRIs are a little bit better tolerated than TCAs, and with dysthymia, it has also been found that both the serotonergic and noradrenergic systems are involved in the medication of dysthymia. So SSRIs only act on serotonin, while SNRIs act on both serotonin and norepinephrine. Um, Noradrenergic agents are especially useful for depression and dysthymia-related apathy. Dopaminergic medicines are also effective for apathy. Um, just remember that everyone reacts differently to different medication. So what works for me may not work for you, but I currently take the SNRI called venlafaxine, which is commonly called Effexor, and I also take bupropion, which is also called Wellbutrin. Wellbutrin is not technically an SNRI, but it also has more noradrenergic and dopaminergic agents. I've tried SSRI medication in the past, but they didn't help me. But they could help a lot of people with dysthymia. It just depends on your how it affects you. It affects everyone differently. And like I said before, in treating dysthymia, the combo of medication and psychotherapy may be much more effective than either one alone. Some different types of psychotherapy that are used for treating dysthymia include cognitive behavioral therapy, psychodynamic, and insight-oriented or interpersonal psychotherapy. There is also a form of psychotherapy that was specifically developed for patients with dysthymia. This treatment is called Cognitive Behavioral Analysis System of Psychotherapy, which is abbreviated CBASP. It uses techniques that teach patients how to handle problematic interpersonal interactions, and it helps patients focus on the consequences of their behaviors and how to use effective social problem solving. They also learn to recognize how their cognitive and behavioral patterns produce and perpetuate interpersonal problems, and how to fix maladaptive patterns of interpersonal behavior. So basically that's all I have to say about dysthymia. Um, if you or somebody you know may have this, there's definitely, you should see a therapist or talk to somebody about it, because I wasn't diagnosed until an emergency situation happened, and I hadn't really sought out therapy before. And for me personally, it's working pretty great. So I hope you liked the video. Sorry for the quality.